Hi, parents. Have you ever noticed that some days your child with autism seems more hyperactive, irritable, emotional, or difficult to manage? And they wonder what changed. One important factor we need to consider is the connection between autism and allergy. Many children of the spectrum have a more sensitive or dysregulated immune system. Their body may overreact to certain food like milk, gluten, egg, or soy, or as well as environment triggers like dust, pollen, weather changes, or food addictive. So when this reaction happens, the body releases inflammatory chemicals. So what happened? These chemicals do not just affect the skin, nose, or the gut, but the chemical can also affect the brain. As we all know, there is a strong connection between the gut and the brain, often called the gut-brain axis. When the gut is inflamed, bloated, constipated, or irritated by the food sensitivity, the brain feels the impact. However, many children cannot say, Mom, I have stomach discomfort. Or, Mommy, I feel unwell. Instead, they communicate through behavior like sudden tantrums, aggressions, increased stimming, poor sleep, brain fogs, dark eyes, circle, eczema flare up, or bloated tummy. Sometimes what looks like bad behavior is actually the child expressing physical discomfort. In addition, allergic reaction trigger the release of histamine, and excessive histamine can contribute to restlessness, sleep disturbance, irritability, and anxiety-like behavior. Okay, so what are the management? Okay, so management start with first, mommy, daddy. You have to identify the triggers, whether it's a food or environment. Then, please keep a simple food and behavior diary, which can help parents notice the patterns. Sorry, reducing processed food and sugar, and considering a supervised trial of a gluten-free, casein-free diet when appropriate may help in some sensitive children. Next, supporting gut health is also important by ensuring regular bowel movement. So as we know, a lot of autism, they have either constipation or diarrhea. Addressing the diarrhea and constipation is one of the main treatment for gut health. Okay, many autistic children may have some deficiency in nutrients such as zinc, magnesium, vitamin D, and omega-3, okay, which play important roles in brain function and immune dysregulation. So when we calm the inflammation, support the gut, and correct the nutrition deficiency, we often see improvement, not just a physical symptom, but also in their behavior. Okay, so parents, remember, okay, if you come across autistic children, okay, even with your own children with allergy, okay, so first, probiotic is very important. Zinc, magnesium, vitamin, to repeat again, omega-3. Yes, please start it as soon as possible because it's really help, okay, to regulate the immune system. All right. But sometimes short term of medication is advisable, all right, to reduce both allergy and inflammation. So using of antihistamines like your flu medicines, steroid for short term, and sometimes like a drug called mast cell stabilizer helps. Okay, for short terms, like around 3 months to 6 months, just have to calm down the inflammation reaction, the allergic reaction, while doing the dietary intervention and waiting for the supplements to see it effects. Okay, I hope it helps. So lastly, as a parent, when the behavior suddenly change, it is helpful to gently ask ourselves, is this behavior, or is this biological causes? Okay, so very often when we support the body, we help calm the brains. Understanding this connection allows us to respond with compassion instead of frustrations, and that can make a powerful difference in our child's journey. Okay, so I hope it helps. I see you in the next presentation. Bye.